A very good evening to all our viewers. Thank you for joining us on this edition of the Evening Review. My name is Toiwan Jabela, your host. Let's look at some of the headlines since tomorrow's Namibian Sun. Tonight on the show, we are very privileged to have the Minister of Health, Dr. Kalumbi Shangula, to expand on some of the messages regarding the COVID situation in the country, the vaccination rollouts, and of course the general state of the health sector in the country. Minister, thank you very much for making time.
It's my pleasure.
Yes, you always make time, and we really appreciate that. So let's start from the very beginning. You became health minister, I think, in December 2018. And it was just at that time when a lot of things were peaking. Our financial challenges as a country, I suppose, and as a world were kicking in, which affected things like the filling of positions in the ministry, so much that the capacity was also affected. And then while you were, scrambling with that whole situation, then COVID came. Has it been a baptism of fire for you just taking over this portfolio and where we are today?
To a certain extent, yes. But I must say that when you accept a responsibility, you must understand that there are challenges. Mm-hmm. And then the challenges, you have to devise ways how to overcome them. Mm-hmm. I was in a privileged position to have worked before in the Ministry of Health and Social Services. Yes. First as a medical officer, then I became a medical superintendent. Mm-hmm. That was in Oshakati Hospital in the north of the country, and then a regional director. Mm-hmm. And then later I became a permanent secretary of the same ministry. I consider myself to have been lucky because I was exposed to all the challenges at all the level of the healthcare. Mm-hmm. So when I accept the responsibility of as a minister of the health ministry, I was fully aware of the challenges which are going to confront me. Mm-hmm.
Yeah. And of course, having served as a technocrat, you were for a very long time a permanent secretary, like you stated. When you eventually got to the pinnacle of the ministry now as minister, have the challenges been slightly differently from the way you saw them as permanent secretary?
Well, I must say that when I was a permanent secretary, it was a different period altogether. And then currently when I became a minister, it was also a different period altogether. So the times were completely different. And immediately, as you rightly alluded to, immediately when I came into the ministry in December 2018, the biggest challenge which was there was hepatitis A.
Yes.
It was a disease which I was convinced that we need to tackle it and to eradicate it because I for one didn't want hepatitis E to become endemic in Namibia. There are very, very few countries who has got hepatitis E, and this is one of the things which I say we must eradicate as soon as possible. We're just in that program of hepatitis E eradication when COVID-19 broke out.
I remember vividly. Speaking of COVID-19, Minister, there's a slight relief now compared to maybe 3-4 months ago when we were battling the deadly third wave. What, in your view, brought this sort of relief that we are now in at the moment? Is it let me not say it for you, but what is your observation?
Yes, we just emerged from a very serious situation, the third wave. Now, the third wave was fueled by a new variant, the Delta variant. And it was a terrible situation. And then, you see, I always like to compare. This is a fight.
Yeah.
It's like we are in a war. And as such, you have to apply, the strategy, the tactics which fit, the challenge. Of course, right from the beginning, we differentiated to say how best do we confront the pandemic. And therefore, we created what we call different pillars to focus like specialized, they are specialized units focusing on specific targets, so to say. We have the surveillance, which in military term you can equate it to reconnaissance or intelligence gathering. You have the case management, which you can equate to infantry or so you apply some certain principles which related to the actual war. Now, one of you have to take the biggest arsenal in your possession. That's the lockdown. But maybe before I get to that, let me just emphasize the fact as to how the COVID-19 propagated. COVID-19 moved from an infected person to a susceptible individual. In other words, you must have the source, and then you must have the body which is ready to accept. And now, in our case, COVID-19 is a new disease. There is nobody before who has got natural immunity against COVID-19. And that's why when it came into a population which is susceptible, the transmission is very fast. And also the fact that the virulence, the aggressiveness of the virus is also another thing. Therefore, you have to employ the tactics and the arsenal which you have. What we did is that lockdown. The lockdown means that you limit human-to-human interaction. If the disease is confined to a certain area, when you lock down, you confine that disease to that particular area and attack it there. You prevent it to spread to other regions, to other places. Then we institute the curfew. It serves the same purpose: limit the interaction among the individuals. Because if it only requires one individual to infect the whole of it, because the population is non-immune. And then, of course, we reinforce public health measures, washing hands, wearing of masks, physical distancing, and also, fortunately, that time we have already started with our vaccination campaign, because initially we went full time with the vaccination campaign in April. But of course, at the beginning, not so many people were vaccinated.
Yeah.
There were several reasons for that. It took time for us to get the vaccines. It was terribly difficult to get the vaccines. And number two, not so many people by then were vaccinated. Now, we are now in a stage where we have seen the number of cases are dropping, the number of hospitalizations are dropping, number of people who are in ICU, very, very little. I think at the present moment we have about 5. And then we see the number of deaths, being cut drastically. There are days where we go where we don't even announce a single death. So it was a combination of the lockdown, the curfew, the vaccinations, and also the reinforcement of other public health measures, which really brought us this relief.
Indeed. And Minister, you spoke about vaccinations. What can you tell us about this COVAX facility, for which the last figure I saw was around 29 million that government has paid for the procurement of that vaccine, and that consignment was taking long to come. Has it eventually come? Is it here now, or are we still struggling to get our consignment?
Okay. The COVAX vaccine, it was a facility. Sorry, the COVAX facility was a special entity created by WHO and other stakeholders. The main purpose was a recognition of the fact that, especially in Africa, there are no countries which manufacture vaccines. And those countries who were producing vaccines, they were first catering for their own people. Then the question came about low-resource country and countries which do not have the capacity to produce the vaccine. What about them?
Yeah.
Okay, let's create an entity which then procure the vaccine from the manufacturers so that we can distribute to the other countries which don't have that capacity. Now, the COVAX facility itself does not produce vaccines.
Yes.
It depends on the producers who are in the developed countries. And I recall when I went to Geneva, okay, maybe before that, I can say that we did everything possible from our side, including the payment. And then when I was there, I talked to the chief executive officer who were discussing. I said, tell me, when are we going to get our consignment? And then I came to realize that they don't have, they just say, the moment we receive a consignment, we then distribute. But unfortunately, what they were looking for, the priority was those classified as least developed countries. Now, Namibia is not falling under that category. It is upper middle income country. And therefore, we did not, we were not eligible to get a vaccine even as a donation. That's why we have to pay for ourselves. But then we are at the tail end. Eventually, we got what we paid for, and the vaccines have arrived. And I can assure you that at the present moment, we do not have a shortage or a problem with the vaccines. For our purposes. We have also, at the beginning, we only had two type of vaccines, the Sinopharm and then AstraZeneca. But currently we have 5 different type of vaccines, just for the public, to satisfy the public's appetite. If you want to go for Sinopharm, it's there. AstraZeneca is there. J&J is there. Pfizer is there. Sputnik is there. Because also many people were asking, when is Sputnik going to come? When is Pfizer going to come? When is J&J going to come?
Yes.
Now everything is there.
Now everything is there.
Yes, and we don't have any shortage at the present moment.
Indeed. We go for a quick break and then we return with our conversation.
Strike it gold and win 5,000 Namibian dollars in cash with Neo Paints. Simply buy Neo Paints products from the selected range and stand a chance to get one of 12 mystery buckets filled with gold paint. All 12 winners will each get 3 extra paint buckets equal to their purchase. One to replace the gold paint, the second to use on your project, and the third to give to a charity of their choice. One winner can score another 10,000 Namibian dollars by showing us your creative use of the golden paint. The best project wins the cash. Offer is valid from 27 September to 18 December at your favorite hardware store nationwide. Visit us at neopaints.com for more competition details and follow us on Facebook for weekly competition updates. Neo Paints, a coat of excellence.
If you're feeling how I'm feeling and you know I won't stop, all we gotta do is take our love to the top. If I got it and you want it and you'll never let it drop, all we gotta do is take our love to the top. I will ride for you, baby, even die for you. When I'm loving you, but my heart don't stop.
We continue our conversation with Health Minister Dr. Kalumbi Shangula. Minister, you are not only battling with a pandemic, you are probably also dealing with a pandemic of a slow uptake of vaccine. People, so much misinformation, so much negative conspiracy theories are being spread around. What is the appetite generally in the country right now? What is the rate at which we are moving? Because I was doing a calculation not too long ago, and I was saying that at the rate that we were vaccinating a couple of, maybe 3-4 weeks ago, the 60% target that is generally the accepted number that many countries want will only be achieved in 2023 or something like that. I did some calculation, I can't remember the numbers. So it was not a very impressive rate at which we were moving. What are the issues?
Yes, you see, at the beginning, it was like a passive approach that you expect people to come by themselves. So that passive approach was not actually accelerating the process. We have realized that, and now we have created, you know, there are clusters made up of government institutions. And one of the cluster is the vaccination cluster, working together with information and mobilization cluster. So now this is to move aggressively the campaign, so that you don't passively wait for individuals to come, but you go to the individuals. Now, one of the issues which we are going to come up with is the creation of the incentives with the collaboration with MTC. With this will specifically appeal to the youth, because they are giving out free data once you have been vaccinated, and I'm sure this will increase the uptake, especially among the youth. And these are the youth who are conversant with the gadgets, and they use them for study, for many other things. Students at university, at a high institution of learning, etc., etc. So this is going to appealing to them, and with this we know that we expect the uptake to increase. There are also some other measures which are being put in place. There will be road shows, and concomitant with that is that whereas we only used to have permanent sites, we have also increased the mobile site. So we say if Mohammed cannot go to the mountain, the mountain must go to yeah.
Yes.
So that's the current approach. And with this one, we are confident that the uptake will increase. So far, we are getting encouraging sign. We have more than 225 individuals who are fully vaccinated, fully vaccinated, and we expect this rate to increase. But we need to do more. And one of the great impediment, as you rightly mentioned, is the conspiracy theories. This is happening elsewhere in the world. In Namibia, Namibians are very good at copying. They copy those things and then they start the anti-vax campaign and spread them. I recall I once met one young person and then say, have you been vaccinated? He said, no. I said, why? I'm afraid because they say if I get vaccinated, I'll die. Just straight like that. Yeah, then I have to explain to the person that it's not true what you're hearing. Look, there are people, when you are sick, you go to your doctor when you are sick. But why you trust the doctor that he will be able to heal you?
Yes.
Now, why, when he tells you that you can get vaccinated, now you believe somebody who has never gone to school of medicine, who knows nothing about medicine, you trust that person, but when you get sick, you go to the person who is going to cure you. So it does not, it beats logic. So let us just think logically. Yeah.
Minister, is the fourth wave a real possibility? And if yes, in what situation must we be found when it hits?
Well, COVID-19, the virus, is novel and not much is known about it. It mutates so much that you do not know what type of variant will come out tomorrow. But let me just say that a wave is a function of the variant, the aggressiveness of the variant, the virulence, the transmissibility of the variants, and the susceptibility of the population. If you have a non-immune population, obviously if the virus comes in, then obviously it finds a fertile ground to propagate. But if you, even if the variant is virulent, but there is the population is immune, then the transmission will be slow and is able to be managed. So during this breather, we have realized during the third wave that actually the third wave, the Delta variant, has created new demand for the health sector. Especially the new demand in oxygen. All along, we had oxygen supply in our health facilities. And that oxygen supply was sufficient for all our needs. And all of a sudden, COVID-19 created an additional demand for oxygen. And this one we have then to create it. So what I can say is that we have now learned what are the possibility, even if there will be another wave, and we are continue to make preparations for that, so that in case there will be a fourth wave, which we would not like, it to happen, but we will be much prepared. By that time, many people might have been vaccinated. That's number one. Number two, we have created the necessary infrastructure. And number three, the space for accommodating whoever need will be sufficient. And I must also say here that during the third wave, one thing I really appreciate what the ministry staff did is to ensure that anybody who requires a bed was able to get a bed. Yeah,
indeed. I have two more questions for you, Minister. One is, leaders like yourself, you don't play just the role of what you are doing physically, you also inspire. One of the questions that has been raised in recent times, and I'm throwing it to you maybe unfairly because you are not the spokesperson of the president, but the president said that he's been vaccinated, and a lot of people do not believe that the president has been vaccinated. They believe that the president, the Hage Geingob that we know, would have had the press around for that moment. We've never been invited to any vaccination of the president. Do you believe that he's been vaccinated?
Yeah, you will recall that before when we're actually preparing for the vaccination campaign, the president said he will be the first to be vaccinated. He has expressed that desire, and he has been in consultation with his doctors. And in one of the public briefing, he produced his vaccination card. He said, "This is my vaccination card." And I can tell you, even before that, before he produced the vaccination card, I can tell you exactly when he was vaccinated. I know exactly that the president is fully vaccinated.
Okay.
Yeah.
Wonderful.
Yeah.
The last question to you then, Minister, is one of the issues in your ministry that are not new, you found them there, is that there are very grave concerns around procurement of medical supplies, medicine, equipment. There are allegations of inflated tender amounts. Your predecessor, Bernard Aufiku, dropped a dossier at the Anti-Corruption Commission to look into into specific incidences. What can you tell us about the credibility of the procurement system? Do you trust it? And if not, are there any active measures that are being taken to rectify what is happening there?
Yeah, thank you very much. The procurement, I'm not sure whether you are referring to general procurement of specifically to the pharmaceuticals.
Yes, actually that.
Yes. Pharmaceutical is a specialized system of procurement. And when the Public Procurement Act came into force, it has really negatively affected the supply of medicine and medical items to the ministry. I do not say this act itself is the main issue or the application of the act. Probably might be the reason. But there are also some limitations, the amount the ministry can buy for, which basically is very insufficient. Because for pharmaceutical, you buy in big bulks, and these are big tenders. If you have got 4 referral hospitals, we have 35 district hospitals, you have got 44 health centers, you have got 285 clinics. To be sure that at every particular time they have the necessary medication according to the name list. This is a massive, massive operation. Now, the experience with the procurement board have been, in order for you actually to get a reliable supply, you must have a long-term contract. 2 years, 3 years. This is what has been missing. Now, if there is no such a thing, then it means you are forced to make a buyout. Now, when you go to a buyout, the one you approach knows that you are you are desperate, so he can inflate the price, and then for you, you have no other option. You just have to buy in order to save lives. It's a choice, which is very unfair to the ministry. We did when in 2019. In 2019, that was the first year when I became the minister. We had a good negotiation with the Minister of Finance. What we agreed upon is that they gave us an exemption. We were able to satisfy the needs, and then the amount was changed from 25 million to 100. So that made a big difference. Now, the problem, while we were stabilizing now the supply, COVID-19 came. Now, when it came in, it means the regular logistic route had been cut off. Disrupted, some of the raw materials to produce some of the medicines, they are no longer there. We have it affected us, especially for chronic ailments. There were nowhere to be bought. Even if you've got the money, there's nowhere to be bought, and it became very expensive. If you have got a consignment somewhere in Copenhagen in Europe, to bring it to Namibia, it became another challenge. Now, these are some of the complications involved in the procurement of pharmaceuticals. We are now in discussions, which has been agreed upon, to make a different dispensation for the procurement of pharmaceuticals. Once this has been operationalized, I want to express the confidence that the issue of shortage of medicine here and there will be a thing of the past. We are working on to achieve that goal.
Indeed. Dr. Kalumbi Shangula, thank you very much for your time. We appreciate it really.
It's also my pleasure because we need a platform to disseminate information.
Yes.
And I also want to express my appreciation to the media. The media has been our reliable stakeholder for dissemination of information, and specifically to the newspaper. You are the editor.
Yes.
I always look down there. There is always a message on COVID-19, which we highly appreciate. And this is the type of support we need, because it is not only a responsibility of the ministry. This is a national responsibility. Because we need to get out of this COVID-19 so that we can go to the normal life. And I would, at the end, really urge people to take advantage of this situation to get vaccinated. You see, we are I'm talking to you. You don't have a mask on. I don't have a mask on. I'm comfortable because we are fully vaccinated. And vaccination should have a meaning to say that we get vaccinated so that we got to that goal where we don't need to have masks anymore.
Exactly. No, thank you, Minister, for your time. I mean, vaccination, I got vaccinated because I believe that it's the right thing to do, not only for everybody else, but even for myself. And what we are longing as people of this country is to get back our country as it used to be, hugging our mothers again in the village, even when they're old, without fearing that we're going to infect them. So thank you very much again, Minister, for coming.
My pleasure.
That is Dr. Kalumbi Shangula, is Minister of Health, sharing with us some of the latest regarding the COVID and other situations in the country. Thank you for watching.